Welcome to Docs on Call, brought to you by Methodist Medical Center, with your host, Gina Morse.
Good evening. An estimated 600,000 women in the U.S. will have a hysterectomy this year, according to the Centers for Disease Control. Traditional surgery requires weeks of recovery, but now women have a new option to consider. A Da Vinci robotic hysterectomy offers many benefits over traditional surgeries. And tonight our experts from Methodist Medical Center share details about this minimally invasive laparoscopic surgery. And tonight's doctors on call are Marc Boyd and Tracy Bochantin. And they'll take your questions when you call at 698-3742. Also standing by is Dr. David Kindred. He is waiting to take your questions online. Dr. Kindred is online, so log on now to, get this, mymethodist.net / health info, thanks for the help, docs on call. That's right now, so log on to get your questions answered online or give us a call. Right now, let's get a look at how robotic hysterectomy works. Here's robotics coordinator and Methodist Medical Center nurse, Suzanne Brown.
This robotic system is new and upcoming technology. It's the newest on the market. With a prostate surgery or any other robotics case, the surgeon is able to have a 3D view of the insides of your body. With that better view, they're able to steer around nerves, blood vessels. They just have a better view and also are better able to do the surgery. This is the robotic cart. This is what actually has the robotic arms, and it actually is up with the patient, and it has some instruments that hook on here. It has a camera that hooks here, and there are surgical staff with the patient, and our surgeon sits back at the console, and he is able to manipulate these arms and the camera just with some fingers. This is the console where the surgeon sits after he's done at the field placing all the instruments and the camera. He comes and sits back here, and they look into the viewer, and they are able to see the picture. They manipulate the arms just with their fingers here.
Pretty interesting stuff. Dr. Boyd and Dr. Bochantin, thanks for being with us tonight. Let's start perhaps by talking about a few of the reasons, maybe the most common reasons, that a woman might need to have a hysterectomy. What do you tell your patients?
Most of the patients that are seeking hysterectomy are ones that are having problems with abnormal bleeding, that have failed conservative therapy, and so surgery is kind of the last option before moving on.
What about, let's talk about fibroids. I hear that's a common reason for a hysterectomy. What would be some of these causes? What would be some of the things you might try first before seeking a hysterectomy?
Well, conservative management would be medication, and there's various medications that we use, as simple as the birth control pill to possibly keep the fibroid from growing. There's a drug called Lupron that we use. Some women just prefer to have the fibroid tumors removed, and robotic surgery to remove a fibroid tumor without doing a complete hysterectomy is also an option for women.
Now, complete hysterectomy is a serious procedure. I mean, it can be really life-changing. So let's talk about some of the impacts that a hysterectomy has, plus what a traditional hysterectomy is like.
Well, some changes that can go on are you are removing a body organ. And so depending on whether you remove the ovaries or leave the ovaries, it can affect their hormonal status. Hormonal status can affect long-term things like their risk for heart disease and stroke. When we start to remove vital organs that are attached to other ligaments, you do run the risk of long-term problems like prolapse, adhesions. So it isn't a decision that they should enter into lightly. You should try conservative methods before you go on to surgery.
And Dr. Boyd, as far as the procedure itself, This is a major surgery, and the recovery with a traditional hysterectomy is quite lengthy.
It is. The traditional hysterectomy involves an incision either up and down or in the lower part of the abdomen. The normal hospitalization is 3 to 5 days, and recovery is anywhere from 6 to 8 weeks.
Wow. That's a long time.
It is.
And that means no heavy lifting, time away from work, time away from the things that you like to do with your family. And so this option now kind of changes that a bit, right?
Correct, because the amount of time in the hospital is a lot less. You're usually looking at 24 hours in the hospital, and really about 2 weeks of no heavy lifting, pushing, or pulling.
That's a significant difference.
Significant, it is.
And this is an option that is available not just in a major metropolitan area, but right here in the Peoria area now. And this is something that both of you and your colleagues are prepared to do. What are you seeing here locally with the interest in this type of surgery?
Well, go ahead. I was going to ask what your experience has been.
Well, it's interesting. This is new technology, but not always does new technology mean better medical care. And this is an option, I believe, markedly improving the health care to women. The console that Suzanne talked about gives us 3 dimensions when we look at patients. It gives us a multiplication factor of 10, so we can see smaller vessels, potential nerves that we may not be able to see with the naked eye. It gives us 3D, HD, so you really are able to visualize the entire area that you're surgerizing.
Wow. And so you're sitting away, as we saw in that video a moment ago, you're sitting away from the patient actually with your eyes into the machine and your hands on the levers that can really help you do even more precise work.
Oh, definitely. Little blood vessels that you wouldn't normally be able to see during an open hysterectomy. Since it is 3-dimensional and it is magnified, now suddenly these small blood vessels are large. And so you can cauterize them, so it usually means less blood loss, less risk of injury to the organs around what we're looking at.
Now, are there circumstances where you will not do this kind of surgery? Or does someone have to meet a certain kind of requirement to have the robotic surgery versus the traditional method?
Very few patients would be excluded from robotic surgery, and it's interesting. Taking a very large patient that may be at high risk for a lot of complications, infection, blood clots to the major organs. In a traditional hysterectomy where they're opened, that patient is at significantly higher risk for developing problems. Pneumonia would be another example of that large patient. Doing robotic surgery, a lot of the weight for that heavy patient is removed, and that person can ambulate much quicker, and that obviously from a postoperative standpoint is much safer for the patient.
And do you have to have a full hysterectomy to use this procedure, or could you do a partial with the robotic?
You can do a partial. And just like Dr. Boyd had mentioned, actually the Da Vinci robot was designed for larger patients. It does make it much, much easier to do a robotic hysterectomy because you're not opening up all those layers of tissue.
Okay. Well, we do have some questions, and callers who are dialing in, remember that number to call is 698-3742. Let's go to our first caller. Diane, you are live with Docs on Call. What's your question?
I have a question with regard to having a hysterectomy. Does it have an impact on one's weight gain in future years, and is that related to possibly having your ovaries removed, or, does it affect you less if you don't have your ovaries removed?
Good question, Diane. What do you guys think?
This is a question we address every day. The actual hysterectomy simply means removal of the womb with or without removal of the cervix. The actual removal of the ovaries is, from a medical standpoint, is a very long-term salpingo oophorectomy, but women usually mean that's a complete hysterectomy. And so in layman's terms, a complete hysterectomy is removal of the ovaries. A partial hysterectomy is removal of just the uterus. The weight gain issues that this caller is calling about goes along with menopause. And menopause occurs the moment the ovaries are removed. And weight gain does become an issue, and that should be discussed with the patient's physician.
Okay. All right. We have another question from a caller. Kelly, you are live with Docs on Call. What's your question?
I was wondering if a hysterectomy is the only cure for endometriosis.
Good question.
Well, what I tell my patients is really the first treatment of endometriosis is really medical therapy. And so usually we try conservative things like either continuous birth control, hormonal methods like Depo-Provera or Depo-Lupron. I think hysterectomy should be safe for the woman who is done with her childbearing years and has failed conservative therapy. Then in that case, doing a hysterectomy probably is the way to go because you remove the offending organ.
I agree.
Okay. Beth had this question. I don't believe Beth wanted to go on air, but she had this question. Is it normal to bleed in between cycles when taking birth control pills? What do you think?
I was going to say that can be a normal complication of an oral contraceptive, and so part of it depends how it's prescribed. We tend to see less breakthrough bleeding when you prescribe it on a cyclic, meaning you take it for 21 or 24 days and then you're off for 4 to 7 days. We tend to see more bleeding in between on the longer oral contraceptives where you're taking them for 84 days at a time.
Okay. All right, we've got another question from a caller. Let's go ahead and see what Sherry has to say. Sherry, you are live with Docs on Call. What's your question?
My question is, if a woman's to have a tubal ligation and she got her tubes tied and burnt, if the process would be to go back and have it reversed after 15 years.
Is that tubal ligation reversible after that amount of time?
Most authorities do not do that today. Tubal reversal is somewhat of a dinosaur, I think, in most centers around the world. Today we would refer that lady on for in vitro fertilization.
And why is that? Why is it somewhat passé, I guess? What is it about it?
Part of it depends on how many children they want. If they're just looking for one more child, then it's probably much cheaper to undergo in vitro fertilization,
no kidding,
which runs about $20,000 versus somebody who's going to undergo a tubal reversal, which you're looking at a much larger expense. Because of the operating time. And then the success rate isn't always the greatest, meaning it's only about a 50% success rate.